Hello everyone, it's Monday, so it's time for our weekly check of how exactly the fight against coronavirus is going across the country. So let's just start by first giving you the big numbers. And it's particularly important to keep track of this because Unlock 1 is now coming to an end, and we're already seeing some states like Maharashtra saying they're going to push forward restrictions till the end of July. I suspect many states are going to be doing something like that as well. But what are the numbers? Now, first, the bad news. It's crystal clear that the total number of coronavirus cases in India are continuing to rise and continuing to rise fast. And the problem is that for nearly 20 days now, the daily growth rate is not moving down below about 3.5, 3.6%. It's averaging about 3.7%. And that means if the growth rate is static, then the absolute number of cases will keep on rising faster and faster and faster every day. That's just the numbers will keep on rising. That's just the way mathematics works. So where we were having cases rising at 13,000 or 14,000 per day, now we are seeing 20,000 fresh cases every single day. And that means that India is at number 3 in the world. You've got USA and Brazil, and then you've got India with about 20,000 fresh cases a day. These 3 countries, by the way, between them are accounting for more than half the new cases that the world is seeing every single day. So that's the big problem. Looking at it from the point of view of individual states, well, obviously Maharashtra is the big one, 1.6 lakh cases. Delhi and Tamil Nadu both with a little more than 80,000 cases. These are the big 3. But what I want to draw your attention to today is some worrying trends that are coming towards the south. Telangana in particular is looking scary because the growth rate there, 10% or more than 10% every day for the last 2 or 3 days. Highest numbers coming in there. Testing is just starting to pick up, so Telangana could be a big problem. Andhra Pradesh is also growing fast. And in the last 2 or 3 days, Karnataka has seen a spurt. Karnataka's so far been handling coronavirus quite well. The last 2 or 3 days, it's been a bit of a spike. We're going to have to see what it looks like. Now, I want to move from this into forecasting a little bit. And I want to give you a basic warning first. This is being done using a very nice tool that Parag Kar has built. It actually just extrapolates mathematically, looking at, let's say, the last 3 days, the last 7 days numbers and growth rates. It forecasts out for a month. So it's not an epidemiological model by any stretch of imagination, but it helps you get a sense of what we could be looking at if we have this growth rate, maybe with some slight correction, because it's possible it will slow down a little bit. Now, what are we looking at if we do that sort of a forecast? Now, Maharashtra, it's looking like 377,000 cases by the end of July. Delhi and Tamil Nadu both at about 250,000 cases. So Delhi a little bit better than some of those more scary numbers that we were looking at, where you heard Manish Sisodia saying it could be 500,000 cases. Doesn't look as if it's going to be quite that bad, but not good either. Telangana, that recent spurt, and if that growth rate is sustained, Telangana could end up at 1 lakh cases. Andhra Pradesh and Karnataka could also end up with 50,000 each. Now, this is, of course, I have to say again, this is just a mathematical extrapolation of recent growth rates. The way it actually shapes out depends on the shape of the epidemic, and also on the level of testing that we see, on the level of contact tracing that we see. Take a look at Delhi. Testing has gone up, contact tracing has improved. The way Delhi is handling the situation has improved dramatically in the last 2 weeks or 3 weeks. And as a result, the picture is now looking better. It's not as bad as it seems. Telangana, a clear indication that just because they're testing more, that's why the numbers are going up. And actually, positivity rate is still very high. So I would be worried about Telangana. What does this mean? You should keep an eye on states like Bihar and Jharkhand and maybe even Chhattisgarh, because their testing levels aren't very high. So maybe there's a crisis out there which we are not completely seeing, which we will have to look at. All right, let me now just come back to the main point. As I've often said to you, what matters is not the total number of cases, but the number of active cases. Because active cases, which is you don't worry about the people who've recovered and gone home, that's what determines how much of a load is there on the medical system. Now, if you look at the forecast for active cases, forecasting it out 30 days, again using the last 7 days as a benchmark. Take the last 7 days growth rate, forecast it out in a mathematical manner. Delhi actually looking better than you may have feared. It may only have 40,000 active cases by the end of July. So all these new beds and these great new facilities that have been built out, I'm glad they've built them out, but hopefully all of them will not actually be required. Tamil Nadu, though, could have 100,000 active cases. Maharashtra, 122,000 active cases. Again, not that much more in the present level. Tamil Nadu is much higher in the present level. But it is possible that the real crisis could be in a place like Telangana. If the last week's growth rates are maintained, Telangana, on the end of July, would have 192,000 active cases. Now, that would be a crisis. Is the medical system prepared for it? And that's what needs to be thought about. So you need to get your act together. You need to test. You need to contact test. You need to see how bad it is. And if it's really that bad and that's what's going to happen, we need to figure out emergency medical supplies, the way Delhi to some extent has done. And it's possible that there could be big jumps as well in Andhra Pradesh and Karnataka. Now, this, as I said, mathematical forecasting based on present trends. You can always reduce how bad it is going to be with proper medical intervention, test, contact trace, and others. But otherwise, get your medical supplies ready. Delhi looking better than we had feared. Telangana or in other possible states looking much worse. All right, let's now take you through to all the big stories today.
The Maharashtra government on Monday announced that the entire state will remain in lockdown till the 31st of July to curb the spread of coronavirus. Under the extended lockdown, the government has empowered district collectors and municipal commissioners to impose restrictions on non-essential activities. The government said that the movement of people for non-essential activities like shopping and outdoor exercise will be restricted in neighborhood areas. Maharashtra, with over 1.64 lakh novel coronavirus cases, is the worst hit state in the country. Maharashtra Chief Minister Uddhav Thackeray on Monday launched the world's largest plasma therapy trial for treating COVID-19 patients. Thackeray has allocated 16.85 crores for Project Platina from the Chief Minister's Relief Fund. All critical COVID-19 patients will receive two 200 ml doses of plasma from a recovered patient. The plasma of patients who have recovered from COVID-19 contain antibodies that help fight the virus. The treatment will be free for all critical coronavirus patients admitted to 21 COVID-19 centers.
ఇప్పటికి 3 గంటలు డాడీ నాకు ఊపిరి ఆడతలేదు గుండె ఆగిపోయింది కిందికి ఆగిపోయింది ఊపిరి ఒకటే కొట్టుకుంటుంది డాడీ బాయ్ డాడీ బాయ్ అందరికీ బాయ్
I'm not able to breathe. They did not continue oxygen for the last 3 hours. It's like my heart has stopped. This last message from a 34-year-old from a government hospital in Hyderabad to his dad has sent shockwaves across the country. The man died soon afterwards. His father alleged that several hospitals denied admission to his son who was suffering from COVID-19. The video message was recorded an hour before the hospital said that the man died, according to reports. According to the Ministry of Health, as on Monday morning, there are 5,48,318 confirmed coronavirus cases in India, of which 2,10,120 are active cases, while 3,21,722 people have been cured. 16,475 deaths have been reported. Among the states, Maharashtra is the worst affected, followed by Delhi and then Tamil Nadu.
Partially relaxing export norms, the government on Monday permitted shipments of personal protection equipment or PPE medical coveralls to other countries for COVID-19 relief with a monthly export quota of 50 lakh units. The product was banned for export earlier but has now been moved to the restricted category. Commerce and Industry Minister Piyush Goyal tweeted, boosting Make in India exports, PPE medical coveralls have been allowed with a monthly export quota of 50 lakh.
The Delhi government will create a plasma bank to fight coronavirus, Chief Minister Arvind Kejriwal said on Monday. The Chief Minister urged those who have recovered from the infection to donate plasma to help other patients. Plasma therapy involves transfusion of plasma from a recovered coronavirus patient to a critical patient. The blood of a cured patient is rich in antibodies that can help the critical patient recover.